This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
From Philadelphia to Erie and from Scranton to Pittsburgh, it's Behind the Headlines. Hi, I'm Charlie Greenewalt, Senior Fellow for the Susquehanna Valley Center for Public Policy, with a new edition of Behind the Headlines. On this edition of Behind the Headlines, we have Ed Arnold, Mr. Ed Arnold, joining us, who's the president of Susquehanna Valley Center for Public Policy, with a new edition of the Arnold Report. Ed, the world of finance and investment, and international finance, seems to be very turbulent. There is always a lot of change, and our viewers have a need for your expertise. And they have written in with a set of new questions. We hope that you'll be able to help us out today with.
Very good.
Okay.
Very good. Look forward.
All right. Well, let me read this the first question that was submitted for you this cycle is: as a former trucking executive, do you believe that we will have trucks driven automatically in the future? If so, how soon? And what will the consequences for us be in terms of jobs and safety?
I think that, first of all, it's going to be an evolution, not a revolution, which is what they're talking about right now, that you're going to have more and more driver assist. It will make the driver's job less pressure in some cases. And basically what I'm saying is that right now, if you were driving on the wide open roads in the West, in Kansas or in Colorado, I can see where the computer could take over and drive it down a nice straight road. And therefore, but you still have to be behind the wheel, and if something happens, you're alerted. But in the meantime, you don't have to be attentive all the time. You can be doing something else. You can even be resting. I can see that. And or for that matter, in the reverse, if you're on the expressways in the Northeast and you're terrible traffic, stop and go, going 10, 20, 30 miles an hour maximum on a straight road, again, the computer could take over the car or a truck and help you so you could get the relief of the most aggravating driving is when you're in bumper-to-bumper traffic. That's very simple for a computer to do. When we're talking about totally operating the car, I think regulations will take a long time. I think safety is a concern. Computers do fail, as we well know. And so therefore, if they fail, they'd cause an accident. So I do think, contrary to all the billions being spent, we will move towards this. But I think, will we have more and more every year? The car will take on more responsibility. But to say that the driver will not be involved, I think that's quite a few years away.
So you don't think we'll, in our lifetime, see a time when the trucks are simply driving without any drivers whatsoever and just driving based on computer technology?
No, I think that's far off. And in the meantime, it's just going to make driving a more positive job because it'll take some stress off the job, and therefore and there is a shortage of drivers, a substantial shortage of drivers. So to say that there's going to be less opportunity if you wanted to be in trucking, the answer is there's still going to be plenty of opportunity.
I think you actually cited a figure not long ago in a discussion we had about how many drivers we're short right now nationally.
Oh, there are hundreds of thousands. I mean, there's no question. There's always been a shortage in long-haul drivers, and this is what it would affect.
So more than 100,000 positions.
Yeah. I mean,
oh my goodness.
The point is, there are millions and millions of trucking. Now, a lot of it's local, but there still is a lot of long haul, and the combination would be there.
Well, certainly something that's caused a lot of furor recently, drawn a lot of attention, is the whole issue of Bitcoin. And we have another question here looking at the large increases and the recent drops in Bitcoin. Should investors still buy Bitcoin and other cryptocurrencies?
Well, first of all, I think you got to put this into perspective. The whole cyber currency, and Bitcoin is the biggest, but there are 1,000 cyber currencies. And I'll admit 90% of the value is in about 10 or so. But the fact is, there are only $200 billion in market cap value. Bonds are $20 billion, gold is trillion. So here we're talking about billion and trillion. And stocks are 28 trillion, bonds are 20 trillion. So really, cyber currencies are very, very small. Do they have the potential to become a bigger factor and still be quite small? And if more people decide to put a small amount of money in them, could it force them up? It's a gamble. Don't invest in money you can't afford to lose. At the same time, would I recommend you put a small amount of money into them? Yes.
About what percentage of your investments would you recommend?
Probably like 5% of the money that you have invested.
Now, you mentioned there are any number of cyber currencies. Can you give our viewers some idea of how many are there?
Well, as you say, there's at least 1,000.
At least 1,000? See, I don't think most viewers recognize that there's so many cyber currencies out there.
Realistically, there's more in the area of 100 that you could possibly go out and try to buy.
Okay.
I think the others are more IP. They're private companies, you could say almost. That yes, they're out there, but it would not be easy to buy. Even anything past the top 10 get quite difficult to do. So the biggest problem with cyber currency is it's not very liquid. It's very hard to trade. It's expensive to trade. It's pretty much a buy and hold.
Okay. All right. Our third question is, what is the future of reverse mortgages in the financial world?
I think reverse mortgages have a place. Especially I think with our challenges that people are retiring with mortgages, and they're finding with their fixed income that their budgets are taxed and they can't afford to continue to pay the mortgage. Well, the reverse mortgage, if you have a substantial equity in your house, can be used. Like anything, there's some reverse mortgages which the fees are substantial and can be difficult. It's not necessarily something for everybody. I think it has a place. It is not in the normal investment community. This is where basically an investment, a finance company will do this, some financial organization. I look at it as maybe a way for families to help each other. Mm-hmm. That you get a reverse mortgage on somebody's house, maybe that you'll eventually inherit when they die. But in the meantime, the burden of making those payments would not be on that individual.
Okay. Another question is from a viewer is, my relatives are arguing whether or not I should invest in annuities for my retirement. What do you think?
I basically, overall, I think annuities are a bad investment. I think inflation eventually will get a lot stronger. And right now, with these older people, health care and your food are big items. So actually inflation is way greater than it looks. Okay. And annuities don't protect you against inflation.
Okay. When will our bull market end, Ed? This bull market has gone on for so long, and how has such a market even been possible? One of our viewers wants to know.
Well, first of all, bull markets run on optimism and greed. And overall, that right now, because of our government, Trump is a very pro-business president, that people are very optimistic. More new companies are being formed now. Actually, the business in America shrank under Obama. There was less and less small private companies because more were dropping off than were being formed because he was an anti-business president. So basically, there is a lot of optimism. Is it being overdone? Is the market expensive? But it's like, it's a baseball game, and are we in the later innings? Yes, but there can still be a lot of runs scored.
Okay. Another viewer wants to know, why aren't antitrust actions being taken against Microsoft, Apple, Facebook, and Google? Don't you think that this is long overdue?
I agree. It's definitely long overdue. I can't believe that our government is not recognizing the power of social media and the internet and the control and the influence it has in our society. And really now you've got a handful of companies that really, almost you could say, are running the country. Mm-hmm. And so basically, yes, I don't know how they're going to do it. I think that they have so much wealth and power that they're influencing.
It almost appears that the government's scared of these companies.
They don't know quite what to do, but I really think it's sad that they're not. I agree with you, they should do something.
Well, the viewer, yeah. Another question from a viewer is, I just learned what small cap stocks are. Are they a good investment? First of all, could you tell our viewers what a small cap stock is, and are they good investments?
It's capitalization. It's companies up to maybe $1 billion or $2 billion. Then you have mid cap, which is 2 to 25 or 50 billion, and then you have your large cap. Overall, they all move relatively similar. There's more volatility in smaller cap. That right now they've done quite well, but in the long run, these diversification in different size companies, if you were going to do it, I would say you do it in an exchange-traded fund, an ETF, which is less expensive, and it'd be a variety of small companies. But overall, I can't say that they're better or not as good as large cap. They go in cycles.
Okay. Last 30 seconds. Last question. Which investing app do you use on your phone, on your cell phone?
Well, actually, it came with a cell phone. At least with Apple, there is actually one that just comes with a phone, which gives you the basic information. You can follow your stock. You can see the news on your stock. You can see the general trend of what it's been doing over the last couple of years. There is an MSNBC app that is out there that you could also use, and I'm sure if you check, there are other minor apps. But overall, you're going to have to get really detailed information. You should probably get a broker. He will give you a Morningstar report. There's different reports you can get that'll have real detail. And it still would have to be the old-fashioned way that you would get a tear sheet.
Okay. Well, we thank you very much for solving some of these issues and throwing more light on them. And we invite our viewers, send your questions in. Ask Mr. Arnold what you're thinking about in regard to finance. We're all out of time for this segment. We'll be right back with segment number 2 of Behind the Headlines.
Behind the Headlines is brought to you as a public service by the Hospital and Health System Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeanne Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Welcome back to Behind the Headlines. On this second segment of Behind the Headlines, the Susquehanna Valley Center for Public Policy is one of the premier public policy organizations in the state, has a responsibility for identifying leading citizens of the Commonwealth who make notable and significant contributions to the betterment of the Commonwealth and the betterment of their communities. And today we want to take a segment of our show to recognize such a person. And that person is Mrs. Jeanne Arnold. Jeanne, welcome to the show.
Thank you.
So nice
Charlie.
to have you with us. Recently, you have been selected to a very distinguished group. They, I think, wanted to recognize your role as one of the leading philanthropists in the Commonwealth of Pennsylvania, and you were just selected to be a Distinguished Daughter of Pennsylvania. Could you tell us a little bit about the Distinguished Daughters of Pennsylvania? What is that organization?
It's an organization that basically recognizes women that have made a significant contribution to their community with nonprofit organizations and volunteer status, where you're giving your time as well as your dollars into different projects. It was started, or the thought was, the whole idea of it was started in 1948 with there being daughters that were recognized in 1949, so it goes back a long time. And every year there are nominations that basically go to the Distinguished Daughters to pick who for that particular year is going to be recognized by the governor as a Distinguished Daughter. So it's kind of like a secret thing that goes on. I didn't even know there was such an organization. And on October 4th, I received the medallion of the Distinguished Daughters from Governor Wolf and his wife.
Well, this is quite an achievement and quite a award, Jeanne, because as I understand, there are only generally an average of 7 ladies or women per year that are added to the organization. Is that accurate?
That's correct. There were 8 in my group.
Okay.
And there are some. I mean, you're going back many years, but there are still 200 of the daughters that are living. So it's got quite a long history.
So the total membership over the course of the years would be then about 500.
It's 500.
Is that about right?
It's around
and
there.
200
yeah.
are still living.
That's right.
Well, this is quite a group of women for the Commonwealth. What does the group do during the course of the year?
Well, I think they meet periodically to basically get nominations that they can recognize other women for the following year. There are obviously donations that come in that basically go to other charitable events or scholarships, and so that's really what is this small group. But
this was an important, and particularly at a time when women weren't recognized in the aftermath of the Second World War, and certainly we've come a long way in terms of equality for women. So I could see the need for such an organization being started, and I'm sure they've done great work. We're so happy that they recognized your work. Who nominated you for this?
The nomination came from Dr. Craig Hillemeyer, who is the president of the Hershey Medical Center and also the medical school. And because of some of the work that I've done specifically with the medical center, he was the one that sent in the recommendation and a letter that I be selected. And from that, I was. Now, I'm not aware of anybody else that contributed to that. There may have been, but this is all very, very secret. I got a letter. I got a letter in the mail from Governor Wolf, which I really wasn't sure what it was, and then an invitation to actually go to the governor's mansion October 4th to be recognized. So, as far as I know, it was Craig that started it, and with my name. And it was a delightful event.
Could you share with our viewers some of the things that you've done at the Hershey Medical Center?
Well, I've been a big supporter of various departments at the medical center, but I think one of the things that I am so proud of is that a number of years ago, Ed and I were approached
Your husband, Ed
my
Arnold.
husband, Ed, yeah.
Okay.
And we were approached by the administration at the medical center for a donation for a new children's hospital. And this goes way back, even before. We did eventually donate to the new children's hospital, but at that point, we weren't interested in doing anything that was bricks and mortar. We challenged the administration, asking them, could you please come up with something that is a program for patients and their families that is really going to make a difference. So we were invited back, and there was a physician, a pediatrician, that we met with, and his whole idea was that there would be a team, that he wanted a team that would follow these really, really sick patients, whether they were in the hospital or they weren't in the hospital, to cut down on the readmission and the trauma to the child and the family. And so we met. He wanted us to meet with two of the moms that had children that would really be, eligible for a program like this. And so we met with the mothers. And unfortunately, one of the little girls has passed on. But the other mom, it really impacted us because she had a daughter, and there were some things that happened. And then when the daughter went home, the little girl went home, she was on oxygen, she was on IV and a feeding tube, and all kinds of things that were going on. So what they wanted was to be able to have a team that they could call rather than running into the emergency room with that sick child. And so we called it the Hummingbird Program. It's been in existence 11 years, and the parents absolutely love it because there's a roadmap for these children that the team forms, and then anytime there's a problem, the team can intervene, and that would mean hopefully less readmissions, or actually if they did have to go to the hospital, the team knows the story. You don't have to reinvent
This
it.
program wouldn't exist without you.
That's correct.
So
Yeah.
that's quite an advance for Hershey. But this brings us to the point where when we look at who is Jeanne Arnold, your background is in nursing. Could you share how you got started and some of the experiences, some of the positions you've had, Jeanne?
Well, I lived in a very small town in Rhode Island. My father was an electrician. My mother worked for a physician. And I always wanted to be a nurse. At that time, for women, we're talking the early 60s, the careers for women, you were either a secretary, a teacher, or a nurse. That was it. And so I always wanted to be a nurse. And I was accepted into the Rhode Island Hospital School of Nursing diploma program, which is a 3-year program. So I went through that and obviously graduated, and then started to do some staff nurse work, mainly in critical care and medical. Then at one point we moved, this was my ex-husband, not Ed, but we moved to Pittsburgh, where I was a charge nurse 3 to 11 in the emergency room at St. Margaret's. And then through a variety of other things, then ended up moving to the Lancaster area, where I got a position at Lancaster General as a staff nurse, either on their intensive care unit or coronary. In those days, you floated back and forth where the need was. But then I was asked to be the head nurse of the coronary care unit. So
You're moving up through the ranks rather
moving
rapidly.
up through the ranks. And then one day got a call from the human resource person at St. Joe's Hospital, when it was St. Joe's Hospital, that they were looking for an assistant director of nursing. The nurses at that hospital wanted someone that really understood what was going on at the bedside. And they recommended me. So I've always had strong clinical skills, and one of the things that I always did in nursing was to work as a staff nurse, even though I started to climb the ladder for administration. So I was hired there at St. Joe's after 11 interviews. Okay.
Oh, wow.
Yeah, I thought they'd bring the Pope over to interview me. But anyway, 11 interviews and got the position. And with the caveat that I would work on a undergraduate bachelor's degree, which I started. I found a program through St. Joseph's College in Maine that would give you certain credits for already being an RN. So I enrolled in that program, and that's where I got my Bachelor of Science in Professional Arts.
Okay.
So from St. Joe's, again, I never actively went to look for these particular jobs, but I got a call that Ephrata Community Hospital was interested in interviewing me for a director of nursing and a chief operating officer position. And so I made the switch to Ephrata, which was one of my favorite jobs.
And from there, that leads to the Good Samaritan Hospital.
It led to the Good Samaritan
Lebanon.
Hospital in Lebanon, yes.
And you were
Senior Vice President of Patient Care Services.
Yes, that is quite a rise to the nursing ranks. But we just have a few minutes left. Your other philanthropic endeavors, though, that you've been recognized for here. You are the only woman who's ever been appointed to the National Council of the Boy Scouts.
The Boy Scouts of America,
and you're
correct.
the only woman. You're the first woman who was appointed. Could you talk for a moment about that? And
well, Ed and I have been big donors towards a program called Scout Reach, which is where there are, in the poorer communities, where the boys can't go because of the expense of the uniforms and the dues and whatever is involved with that, in addition to the fact that we couldn't get the leaders there within those communities. So Scout Reach basically is a fund where the leaders are actually paid, and all the things for the boys are paid as well. So we started with that as one of our major philanthropic donations, and went down to Texas, where I gave a speech on why we were doing this, why it was so important to us. And I was asked then by Dr. Robert Gates, who was the volunteer president, if I would lead a task force on the prevention of childhood obesity, not just for the Boy Scouts, but also for other youth-serving organizations. So this was a big thing.
Well, you've done this nationwide. This was a nationwide
At
effort,
this
and
point,
it's ongoing.
It's ongoing, and how we approach that, I had a lot of different meetings to see how do you start something like this. And so one of the new camp executive, Matt Adams from the Dutch Council, he said, why don't we just start in the camps? What we're feeding the boys in the camps, what the physical activity is, and some things that would really challenge that. So from that, we now have a toolkit that any of the camps can go into and look at the diet and change within their camps.
Yeah.
So,
quick question, and we're almost out of time. What do you think about girls joining the Boy Scouts?
I think it's great, and I'll tell you why. Because in these poorer communities, there are the girls are going to it anyway with their brothers. This is more of a family orientation, where a mom doesn't have to drive, a girl one way and the boy, they come together. And it's been happening for a number of years that girls, the sisters are involved. But they can't get the merit badges, they can't get the recognition, and hopefully this is going to help. So I'm in support of it.
Okay. Unfortunately, we don't have enough time to cover all of your accomplishments. You've been a member for many years of the Lebanon Valley College Board of Trustees.
Yes.
And you run, last thing that maybe we can wrap up with, you run a fashion show every year at Hotel Hershey, and that raises significant money for what cause is that for?
That's for the Hummingbird program.
Okay.
That's what we do. And, I am so proud of that. It is a partnership with Neiman Marcus, and I have a great committee, and we really, this past December, it was unbelievable. The fashion show was just unbelievable. So we started out where we were raising $60,000, and now we're up to over $100,000 we raised at this fashion show. So I'm extremely proud of it. The other thing, really quickly, is with what Dr. Gates asked me to do. I also got involved with many organizations in Lebanon, Hershey, Lancaster, and we've got something that we call Better Together Lebanon. And it is where we've got over 200 organizations that are working on issues that are in the Lebanon community, not just Lebanon, Lancaster, based on community needs assessments, the things that we can hopefully make better. And I'm very, very proud of what that's been doing.
Well, this recognition was long delayed and much deserved, and congratulations again.
Thank
and we
you.
need to have you back to talk about some of these endeavors, Jeannie, in the near future. With that, we have to wrap up today. We want to invite you back again next week for another edition of Behind the Headlines. We'll see you then.